Courtney.
Okay, so I'm in my bachelor program at Anderson University. And we had to come up with a change project for to initiate in the facility where we work. So the change project that I'm initiating is decreasing interruptions and distractions because they have a negative effect on medication administration. So the problem statement basically is nurses experience interruption and distractions every day, and they can cause an increased chance of medication errors and mistreatments for the patient. And the problem with that is it decreases patient safety, and the patient outcomes are negative and not positive. So, pretty much the purpose of this project is to bring this problem to the light of administration, to let them know that we are experiencing many interruptions and distractions during our med times, and to see if we can come up with ways that we can fix it or to decrease them. We had to choose a theorist, a change theorist that we could apply to this project when we implement it, and I chose Lewin's change theory. Basically, there's 3 steps. You unfreeze the behavior that staff has now, and then you initiate the change, which is decreasing the interruptions and distractions. And then once you see that it's positive, then you refreeze it, and then that behavior becomes part of the daily responsibilities of the nurses, the MHAs, and any staff that comes into contact during medication time. So, some evidence that I found alarming when I was doing research on this was that during a medication pass, the nurse can be interrupted almost every 2 minutes. Research shows that interruptions during times of high risk times, such as medication administration, causes the risk of errors and patient harm. Medication errors are increased by 12.7% with each interruption, and the risk doubles when the nurse is interrupted 4 times and triples when the nurse is interrupted 6 or more times, which is not uncommon during a med pass on the RTF to be interrupted over 6 times. Studies show that 13,000 outcomes of where the nurse was interrupted, 90% of those incidences resulted in negative results, such as delay in treatment, mistreatments, missed meds, and mistakes. So some of the methods I thought we could use to implement this project is to pass out questionnaires, find out from the nurses what kind of interruptions they're experiencing, how often they're happening, and then take those questionnaires to administration to try to figure out interventions that we can use that are feasible on the unit. I suggested that we could increase the staffing. MHA, there needs to be a 3rd nurse on the RTF. I feel like the 3rd shift secretary could stay longer in the morning to answer phone calls until the 1st shift secretary comes in. Scheduling TLOAs for after med pass, nurse practitioner, not seeing kids during med pass, things like that. So the overall outcome that I hope to achieve is just bringing awareness to all the staff about how important it is to have a clear mind and be able to focus on passing out meds to our children, because it's very important that nurses' main responsibility is patient safety. And I don't want us to have a medication error that results in adverse results for the patient when we can try to prevent it. I don't want to wait until it happens and then try to fix whatever was wrong in the first place. I feel like this change can increase the patient safety, it can increase positive health outcomes and patient satisfaction, because I feel like we can spend more time with our patients with increased staff, and we would know our patients better and be able to take care of them better. So I hope that it's successful, and I feel like if everyone gets behind it and is open to the change, that it will be. So do you guys have any questions?